Hey everyone, and welcome back to Visceraverse. After we conquered the foundation of the occipital bone in the previous video, in this video we're going to level up to arguably the most complex bone in your entire body, the temporal bone. It is not just one bone, it's a fusion of the parts that houses your hearing balance and key nerves. So let's break it down and unlock its secrets. Just a quick revision of the skull anatomy that we discussed in our previous video. When we look at the skull, we want to think of it as two parts, your facial features and the cranium, which is composed of the frontal, sphenoid, temporal, occipital, and parietal bones. Our today's focus is going to be your parietal bone. The parietal bone is technically two bones. One is found on the right and the other one on the left, as you can see here. Let's look at the temporal bone from different angles and in more details. Here, this part, we see it from the internal part. This is the internal part inside of the skull, and this is the squamous part, the petrous part here in blue, and the mastoid part, as you can see here in orange. If we're going to look inferiorly, then again, we're going to see the bone here with its squamous part, the tympanic part, right? Here we have the mastoid part and the petrous part. And an important process we're going to talk about later on in this video is this styloid process. Again, here we're looking at the lateral side being here and the internal side here. Again, the squamous part, the petrous part, the mastoid part, and the tympanic part in green, as you can see here. Where is the temporal bone located? It forms the lower side and the base of the skull. And we said that it has four main parts: the petrous, the mastoid, the tympanic, and the squamous. For the sake of this lecture, we're going to only focus on the squamous part and the petrous part. The squamous is a flat part. It's a scale-like plate. The petrous part, however, as you can see here, this one is dense and it's rock-like pyramid. A major important landmark here to keep in mind is the mastoid process that we're going to see in a minute. This is a bony bump that you can feel behind your ear. Our mnemonic for the occipital bone, as we discussed in the previous video, was MCE, my curly hair ends. For this temporal bone, however, we're going to use the mnemonic M.A.S.S. M stands for the most important bony pump that you feel behind your ear, and that's the mastoid process. This is your mastoid process. And why is it important? Because it's a major attachment for a big muscle in your neck called the sternocleidomastoid. This is important for the head rotation as well as other muscles being attached to this mastoid process. A stands for the zygomatic arch, and as you can see here we have our temporal bone, and it forms most of the zygomatic arch. However, the remaining roughly 1/3 is formed by your zygomatic bone. The function of this zygomatic arch is attachment for the masseter muscle, which is a very important muscle in terms of mastication and jaw closing. The first S in our M.A.S.S. mnemonic stands for styloid process. The styloid process is a long, thin, dagger-like spike, and I put this picture here to help you remember that. The styloid process looks like a dagger. It's very tiny and it's important in terms of attachment for three muscles, including the stylohyoid, the styloglossus, and the stylopharyngeus. It's also important for attachment of two ligaments, including the stylohyoid and the stylomandibular ligament. And we're going to dedicate a different video for all of these muscles and ligaments. The second S in our M.A.S.S. mnemonic stands for the Stylomastoid Foramen. The Stylomastoid Foramen is located at the base of the styloid process. Again, here is your dagger-like styloid process, and at its base, looking inferiorly, we're going to see the stylomastoid foramen, this little opening here. Why is it important? This is the exit point for the facial nerve. The facial nerve controls all of your facial expressions, all of your facial muscles. Clinically, if there is any damage in this area, you eventually end up damaging your facial nerve. That's going to lead to facial palsy, aka Bell's palsy, as you can see on the screen here. When it comes to the temporal bone, we have two important critical gateways. These are your external auditory meatus and your mandibular fossa. Looking laterally at this bone, you will see your external auditory meatus. This is your ear canal and it funnels sound in. The mandibular fossa is the socket of the temporal mandibular joint, and this is important for your jaw movement, and we're going to see where it's located in a minute. Looking inferiorly at the skull, we can appreciate the mandibular fossa. It's found at the base of the zygomatic arch, right posterior to that, you can find it. And again, it's important for the temporal mandibular joint, which is crucial for the movement of your jaw. Now, let's look underneath at the skull base where we can appreciate three main things. One is the carotid canal. This is the tunnel for the internal carotid artery, which is the major brain blood supply. Looking right medially to your styloid process, you will find the carotid canal. And again, it's important for the passage of the internal carotid artery. Slightly posterior to it, you will see the jugular fossa leading to the jugular foramen. The jugular foramen is important because it's a passage for the internal jugular vein. This is the major brain blood drainage. Lastly, we will look at the hypoglossal canal. This is actually a part of your occipital bone, and you can see it right anterior to the condyles, and this is important for the passage of your hypoglossal nerve. This is cranial nerve number 12, and this is important for the innervation of the tongue. Let's quickly recap what we discussed in this lecture. The M.A.S.S mnemonic will help you remember the most important structures or features in the temporal bone. And one way I love to remember that is that in your temporal bone you have the mastoid process, which is the bump behind your ear. If you feel it, I want you to remember the word M.A.S.S. And to make it easier, mastoid. M.A.S.S stands for Mastoid Process, Zygomatic Arch, Styloid Process, and Stylomastoid Foramen. There are two critical gateways in your temporal bone, including the external acoustic meatus and the mandibular fossa. The highways for vessels and nerves, including the carotid canal, the jugular foramen, and the hypoglossal canal, which is actually located in your occipital bone. That's it for today about the temporal bone. In the next lecture, we're going to discuss the internal features of the temporal bone and the occipital bone. In the previous lecture, we talked in more detail about the occipital bone. Lastly, I'd really appreciate it if you subscribe to our channel and follow me on Instagram, where I share study tips and help you make your medical journey more enjoyable. So see you there and see you in the next video.